Hey, welcome to the channel. My name is Dr. Erickson, and this is...
Dr. Anderson.
So this is the most common type of low back pain that we want to talk about. So people tend to fall into different categories. Not always, but in general, people will fall into kind of a bucket as to why their back pain happens, what makes them better or worse. And that's why we ask those questions. And that's why, honestly, why we move people around and see, okay, how far can you, what happens when you bend forward? What happens when you bend backwards? What happens when you twist, or side to side? Or, what happens when you sit versus what happens when you're standing and walking? So Jake kind of talked us through what's the most common type of low back pain and what we're looking for, and then why someone should not necessarily completely get rid of that movement, but slowly bring it back in.
Yeah, so the most common type of low back pain that we deal with is called mechanical low back pain, and there's categories within that. But mechanical low back pain just means it responds to different movements, positions, loads, things like that affect it. So the most common category of mechanical low back pain that we see is flexion intolerant low back pain, which means people don't like the bending movement, sitting, rising up from a seated position, squatting down, bending over at the waist, anything that involves that flexion of the low back.
First thing in the morning.
Yeah, first thing in the morning. That's the most common aggravating movement is low back flexion, the most common aggravating or sensitive movement that those people experience.
Yeah.
That doesn't mean everybody's going to have that issue, but that is by far the majority of people are going to fall within that category of flexion intolerant.
And they tend to feel better with being up and moving around.
Walking.
So even sitting, depending sometimes on the chair, if it's a soft like couch where they're kind of like sunk back into it, that tends to be worse. Especially like you said, that rising, when you first get up, it's kind of hard, or you feel like you're a little bit stuck. And then as you kind of walk a few steps and get it loosened up, it feels better.
Exactly.
So that tends to be the most common type, and they tend to respond to moving into the opposite direction, which is extension. But often what we see is people kind of feel like, well, I was told or I saw, to do more of like the bending or more of the stretching. Because it feels difficult to bend forward and you feel that stretch, you naturally want to kind of work into that one.
Yeah.
Which we find, for some is okay, but for the majority is not the direction they need to go into, and we tend to move them opposite into extension, where they actually have their biggest loss. Typically, they feel very stuck and stiff going backwards because they're so intolerant going forward.
Yeah, so when people have this issue, it's imperative that we move them around and test different positions. Like Chris said, most of those people are going to respond to extension, but not always. No. Some of those people respond to side movements or rotational movements. And
sometimes load too. Sometimes it's standing versus lying down versus...
Yeah, top down versus bottoms up, whatever it might be. But the key is we have to listen to the patient's story. A lot of times when we're taking just a history on a patient, asking them questions about their pain, they pretty much tell us what's going on, what's wrong with them, and what aggravates
makes them better, what makes them worse, how long have I had it. Any kind of peripheralized pain into the leg would be a key or a flag for us, as opposed to just low back pain. All those things are important.
So a common question that we get is, it kind of hurts when I do this exercise or this stretch. Should I keep doing it, or is that making me worse? And it's a difficult question to answer just asked out of the blue. But when we're in the assessment method, where we're testing people out and seeing how they respond to those movements, it might be good for you, or no, it might not be good for you temporarily. But at the end of the day, like, no exercise or no stretch is inherently bad
or good.
Yep. Right.
Everybody asks, like, give me these. What's your top 3, top 5 exercises?
Yeah,
it depends.
No,
like everybody's different.
Yeah.
And like Jake said, there is no inherently good or bad exercise. It all depends on the mechanical cause and effect relationship between that movement and your symptoms. So, like you were saying, sometimes it could kind of hurt, like maybe to bend, but then as soon as I stop, no, I'm no worse. That's okay. Yeah. Yellow light, I actually keep exploring that. It's not wrong to produce a pain as long as it quickly calms down afterwards, or or the opposite, right? It kind of hurts when I go backwards, but then when I stop, nope, feels okay. I'm no worse. Okay, keep exploring. Neither are wrong at that point until until we do enough of them and we pick a direction and stay with it long enough. And like 2 sets of 10 is not enough. It's got to be 50, 60, 70 reps to really say, okay, this makes me worse, or now I'm stuck, or I can't move as much, or the pain is lasting, or at first it kind of hurt to do, but then because I didn't quit and because it wasn't worse afterwards, I kept trying, I kept testing, going a little further, but then after about 30 or 40 reps, now it starts feeling better. Okay, that's information then.
So that's a hard concept to kind of understand. So a lot of people, they'll start trying different stretches or exercises on their own, and they'll start to produce a little bit of pain, and then they stop because, oh, I'm making myself worse. I'm not going to be able to do this. This isn't what I should be doing because it feels like it's worse.
Which is not true.
That's the hardest thing to understand from your perspective as a patient, because naturally that's what you want to do. If it hurts a little bit, you want to avoid it. But a lot of the times what we find, especially in these flexion intolerant, low back pain mechanical cases, is that you have to produce or work into that painful movement at least to a point until it becomes unpainful.
Yeah. And what happens then if you avoid, so a lot of times it hurts to go in all directions,
Yeah.
right? So I can maybe find this kind of middle ground where the pain isn't too bad. It's
And you stay there.
4 out of 10.
Yeah.
But then if I bend forward, it's 6, 7. If I bend backwards, it's 6, 7. If I twist, it's 6, 7. Well, then it trains your brain to say, well, I'm not going to move at all then. I'm just going to keep it like very neutral.
Tense.
Actually, some clinicians even really teach and
Neutral spine.
yeah, like really produce or not produce,
Coach.
advocate.
Yeah.
Yeah, like just don't explore the end ranges at all. Well, for us,
End range is everything.
yeah, and every end range is everything, and you live life in. You have to be able to bend to pick things up and to lean backwards and to twist
Yeah.
to get things out of the back seat of the car. You can't live your life in neutral where you're a robotic, very stiff movement. That would not set you up for future success with your movements.
Yeah.
To be scared to move. So testing end range is important.
Yeah. So the goal in these cases is if you come in and you're one of these people that fits that category of mechanical, flexion intolerant, low back pain, the first thing we got to do is find out which movement is going to increase your range of motion. Usually it takes one movement to increase your motion in all
Well,
directions.
let's back up a second. Just
Yeah.
define mechanical spine pain. So what we're saying here is we don't even talk about anything leg or like
Yeah, just
sciatica related at all.
purely spine.
Just my left lower back hurts. It doesn't hurt all the time. It comes and goes. I can make it better. I can make it worse. Some days I wake up and it's really stiff. Some days I wake up and it's a little bit better. Some seats I can sit in for a long time. It doesn't bother me. So it changes. It's typically intermittent, although it could be constant, but it
Yeah.
at least changes in
Ebbs and
intensity.
flows.
Yep.
Yeah.
And there are absolutely positions, movements, time of day, activities, things that adjust and
Change
change
it.
that pain. That's
Yeah.
mechanical low back pain.
Yeah. So the key is, finding out what movement's going to be best for your specific spine and your specific body, because everyone's going to respond different. Chris will respond different than I will respond. Find out what that is. Restore range of motion. Once range of motion is restored, including those painful movements, you eventually have to work back into those painful movements because it's normal and safe to do that.
Yep.
And then we need to build strength in those positions so that we can help resolve the
Throughout
issue.
the whole- yeah.
And then keep this issue away as much as possible. I mean, we can't prevent it 100%, but the goal is to limit the amount of days you're going to have with low back pain,
And feeling comfortable and confident in those
which are key
end
to
ranges.
recovering anyway.
So what Jake was saying too, like let's just say that the bending was a worsening for you.
Yeah.
So initially, it is probably okay to at least limit that, not necessarily fully avoid it. We test it every
No.
once in a while to see if it's still there, but
Calm things down.
yeah,
Yeah.
limit that aggravating movement for now. Find a different direction or load or position
That feels
to
good.
decrease things.
Yeah.
But then you have to eventually go back and kind of test that, and whether it's top down flexion or bottom up knees to chest flexion, we have to get back into that eventually, adding some weight, working on hip hinging, working on getting that thing all the way down to flexion to increase the load tolerance, which we've talked about in other videos. Those tissues to then become strong enough to tolerate things like picking up groceries off the ground or bending,
Yeah.
bending and twisting to get something that we have to get back to doing for normal life.
Yeah. And we understand it. We know exactly how limiting and scary these things can be. We see it every day.
Yeah.
And
I've had it.
Yeah,
Jake's
I've
had
had
it.
I've got it right now.
He still needs to work into the extension movement.
Yeah.
I used to have to go that way, and now I actually prefer to bend. I prefer to flex.
Yeah. It can change.
Yep, it can change over time. The direction that worked the last time didn't. The exercise, you've had this before, right? Let's just say you've had this before. I used to do whatever it was, and it felt better. I was fine for a while. I re-aggravated something. I have the same pain again, and now that same exercise
Might not be
or
the one.
movement
Yeah.
or stretch not only doesn't help, but it actually hurts now. Okay, it's fine. The exercise itself is not
Yeah.
bad or good. It just at this time, that one is wrong for you at this time. We might be able to get back to that eventually, but it's they don't always come back or respond or resolve with the same movements every time.
Yeah. So if this sounds like you, and it's probably going to, match with whatever you have, especially if you're dealing with low back pain. It's probably going to line up with what you've got. Ask us some questions, post in the comments, holler at us, DM us, whatever it is. We'd be happy to answer any questions, shoot another video, try to clarify things as much as possible. But yeah, I mean, Chris and I have a goal of helping people with this issue. So that, I mean, this is the number one cause of disability worldwide is low back pain. So we want to help as many people as possible not have to deal with it because it does suck.
And getting some clarity and some
Confidence.
answers to it
Yeah.
is definitely helpful, because what we find the most common thing is people are just, they're passed kind of through the system. They get, special tests done, they get medications, and no one really kind of helps them take control of it, so they know, okay, what can I do to help myself to fix this? That, because you don't want to rely on another person
Painkillers.
or a system, like a health system or a medication, to solve that problem, because in general this problem is very solvable, with movements, with activity changes, slightly for a while, right? So limited activity modifications, and then working back into those things and getting back to a normal life.
Yeah, recovery's possible. Yeah. All right, we'll catch you guys on the next one.